Regardless of your age, whether you're 22 or 82, perhaps you've dealt with or you're dealing with chronic pain. Now, I know this sounds a bit like the opening of a late night infomercial, but it's not. This is actually an invitation to a workshop that will help you train your brain to reduce pain. Oh, and we could probably also show you how to make up real complicated rhymes, just like that one. So anyway, stick around for a sneak peek or a preview of what you can expect in this upcoming workshop. Hi there, my name is Ed Humphrey and welcome to About Townshippers. This is a web series where we talk about the organizations and the services and the topics that are important to English speakers living in Quebec's eastern townships. Our guest today is Alexia-Coulombe-Levesque. She's a physiotherapist and she's a grad student in the field of chronic pain. And on June 8th, she's going to be co-facilitating a real interesting online workshop called Pain and Your Brain. Now, open to everyone, this workshop will show you how and why your brain, increases or decreases pain signals and how you can train it to reduce pain. You know, I could probably use it for my lower back. Anyways, she's with us today to give us a sneak peek or a preview at what you can expect to learn during this upcoming workshop. Well, good morning, Alexia, and welcome to About Townshippers.
Hi, thanks for having me.
Hey, I got a question for you. I've got a couple questions for you. Have you ever heard of the red car phenomenon?
Yes, I have. Why are you bringing it up?
Once, say for example, you buy a red car, all of a sudden you realize, oh, my neighbor had a red car and someone down the street has a red car, and you start seeing all these red cars. So I guess it has to do with the way the brain, those red cars were there the whole time, but you're kind of more, you're primed for it. So you see it more often. Mm-hmm. It's kind of like the people that are always look for the good in situations. Well, they'll find it, right? Yep. But the way the reason I'm mentioning it today is because in the work I do in the community and in the English-speaking population and with the French-speaking population as well, and I work on some seniors projects, I'm hearing more and more about chronic pain. And I'm 57 years old, so I've heard friends talking about it. In my work, I hear about it. So it just seems that it's becoming a bit of a hot topic or a trending topic. So am I mistaken?
Yes and no, because the red car, there's indeed not that many red cars. And so once you buy it, you notice them more, but they're still kind of rare. Whereas chronic pain is super prevalent. It affects so many people. There's about 500 million people on the planet who have chronic lower back pain. Just that specific subset of chronic pain, 500 million people on the planet. And so you might notice it more, but it's always been super prevalent. There's more research about it now, though, because we're realizing that it's this global phenomenon, and with advances in neuroscience, we can understand it better. So there's more research, but it is very, very prevalent.
See, now I'm disappointed because I told you I've got some lower back pain, and I thought I was special, but now I've got a billion people that share this affliction.
Okay. Good news for you though, because we study it a lot.
Oh, perfect. That's great. Well, you're a graduate student at the University of Sherbrooke, and you studied in neuroscience, and you work as a physiotherapist. And now your main field of study is chronic pain. So, why that field, why that subject, and maybe you can elaborate a bit more on why it's important.
Yeah. Well, it's fascinating. That's why I study it. And it's very much at the intersection of neuroscience and physiotherapy. So in neuroscience, we learned a lot about how the brain works. And so just learning about the nervous system and memory and the musculoskeletal function, but specifically starting from the brain, how the motor system works. But it was very theoretical. And then you have physiotherapy, where we learn about all these conditions and how to treat injuries. And we do have a lot of chronic pain patients, but we don't have that many hours of training specifically related to chronic pain. And so having this knowledge, this expertise from the two fields, is combining them just allows us to do really interesting research. And it's quite coming to your second part of your question. That's so important because, like I said, it's so prevalent, and we're just now starting to have the tools to properly study it, understand it with imaging and just understanding how the nervous system works, because it's such a big, it has such a cost on society with people not being able to work because of chronic pain and not being able to have good quality of life because they can't do their activities. It's a huge weight on society, and quite important to study it, understanding it, and understanding how to treat it.
Okay, and it's a financial weight on our health systems as well, right?
Yeah,
On our
yeah,
healthcare systems.
yeah.
Oh, okay. Well, I'll be honest, in the limited reading that I've done on chronic pain, I've noticed that depending on your age, we experience and we approach chronic pain differently, whether we're a senior, whether in middle age, or whether we're youth. And the severity varies, from one age group to the next. And should we be surprised about that, or?
I mean, it's not that surprising. It's definitely not a good thing that it happens that way. Just to give you some stats, about 1 in 10 adult has chronic pain. And with seniors, depending on the study, the most conservative estimate is 1 in 4. And some studies report that up to 1 in 2 seniors has chronic pain. So it's definitely more prevalent in that age group.
So I want to jump in there, but is it a misnomer to think that, wow, she's 72, of course she's going to start feeling some pain, or he's 80? It's normal. You get more pain as you get older.
That's a really common way of thinking about it, and that leads to seniors not seeking treatment for their pain because they assume it's normal. They assume that as you age, you'll have more arthrosis, and that leads to pain. And so it's just the normal way of the body works, but it's not. And there's some really interesting studies on musculoskeletal lesions and how they relate to pain. And so if you take, there's so many studies, but just to give you an example, knee arthrosis. If you look at the correlation between the severity of the knee arthrosis and the severity of the pain, there's basically no correlation. It's very weak. And so you have people with, on x-rays, they look like they have really severe arthrosis and they have no pain at all. And then others have just a little bit of arthrosis and they have a lot of pain. If you put anyone that's over 30 years old in a scan, you'll find arthrosis in their body, even if they don't have any pain. And so, yes, your body will age and you'll have more arthrosis as you age, but that doesn't necessarily mean that you have to have pain that comes with it. But a lot of seniors think that, and so they just assume it's normal. Or, so sometimes seniors don't want to be a pain on their family and friends, and they don't want to complain. They don't want to seek treatment. They just want to, not be a burden on anyone. And so they don't seek treatment. Just assume that they can grit their teeth and push through and then it's normal, but it's not. And if they were to seek more treatment, then we could treat them better and increase their quality of pain and decrease their pain.
So now, if I understand you correctly, then as we get older, we have a tendency to kind of either A, brush it off, or B, not get treatment, or C, not talk about it. Whereas if we're younger and we're having some kind of a chronic pain, we have a more tendency to call our physiotherapist or call the doctor or go to our naturopath, or is that what?
Yeah, so that's one thing that explains this discrepancy that we find in the prevalence of chronic pain between young people and older people. There's also the fact that, yes, your musculoskeletal system ages, which is not necessarily something that will bring pain, but your nervous system also ages. And because pain is related to your nervous system aging can increase pain. So we have these modulation mechanism that comes from your brain, and it just creates widespread analgesia in your body. And so it's a way that your brain can control the amount of pain that you're feeling. And these mechanisms are less effective in older people. And so they'll be more susceptible to having these longer lasting pain of higher intensity because these dampening mechanisms are less useful, less good.
Okay.
So that's another thing. And treatment's also a little bit more complicated sometimes because, meds are often used to treat pain. But then with the older population, often they already are taking a couple of other medications for other conditions. And then you have to worry about interaction between these medications. And so sometimes you can't give them the med that you would like because it would interact with something else or create just other effects. And that's why it's a little bit less easy to solve it like that with painkillers. The approach then that you need to use is multimodal, which is what works best for just chronic pain in general, not even particularly seniors, is to have, some physiotherapy, changes in your lifestyle, sometimes changing the way that you think about pain. So getting rid of that assumption that because you have arthrosis on the x-ray, you'll be stuck with pain for the rest of your life. And so having this multimodal approach works best, but it's a little bit harder to get into. And so sometimes that can be a barrier for treatment as well.
Okay. I remember when I was a kid, and my mom was trying to, I just remember her saying, "Ma, no, you didn't stub. It's all in your head. It doesn't hurt. It's all in your head." And I mean, it did hurt, whatever. It wasn't chronic pain. It was, the pain, I stubbed my toe or I cut my finger but we're hearing a lot more about the benefits of meditation and things like that as well on pain management, and that we have a lot more control than we think we do.
Yeah, absolutely. And when patients tell me that, does that mean that pain's in my head? Yes, all pain is in your head, but it's not in your imagination. It's in your brain. And your brain is, physically inside your head. But it doesn't mean that you're imagining the pain. If you feel pain, your pain is there. It's real. But pain is an alarm system. It alerts you that something is wrong. And sometimes that alarm system can be a little bit overly sensitive, like your fire detector going off if you burn a candle. And then once it becomes overly sensitized like that, then the question that you need to ask yourself is not, is the pain true? Is the thing, the trigger that triggered my alarm, is that actually dangerous or not? And that's how you can start to, retrain your brain to not feel as much pain. And so meditation can help. And there's a bunch of other things I'll be talking about in my workshop of how you can deal with your nervous system and train your nervous system, because the brain is made to learn. It's really good at learning. And so if you just approach it the right way, you can, retrain it to feel less pain.
You're good. You're good. That's great. What a great explanation. That's wonderful. Very, very visual. Okay. Well, that's a great segue as well. I mean, you have a workshop coming up on June 8th, and it'll be a virtual a workshop. So what can participants expect?
Yeah, well, first I'll be talking, the first thing that we need to understand is how pain works, because we all have this instinctive thinking that if you have pain, it means that you have tissue damage. It means that you have a bone that's broken or a muscle that's torn up, or there's something that doesn't work in your body. There's something that you need to protect. And sometimes that's the case, but it's not always the case. Sometimes you feel pain even though there's no tissue damage, just because your brain has learned to associate a certain movement with danger, and so it doesn't want you doing it anymore, and so it just sends you pain signals so that you avoid that movement. Or you can have that alarm system that's a little bit overly sensitive, and as soon as you do something that looks like it might get you to maybe push your limit of your physical system, then it goes off, sends a lot of pain. And so we first need to just understand what is pain and how does it work, and how does your nervous system deals with it and amplifies the signal or diminish it. And then once you understand how it works, then you understand how you can affect it yourself, and how you can kind of trick your brain into amplifying or decreasing certain signals. Once you understand how it works, you can play on it. And so there's going to be kind of two parts in the workshop: how to understand pain. Once you understand it, how can you play with those signals?
Now, is it an open workshop? You're looking, is this aimed at seniors or, the public at large, youth?
Anyone can join it. Anyone.
Okay.
I mean, I think, this should be taught in elementary school, because it's such good, important knowledge to have. And sometimes just that can change the way you think about your pain and how you deal with it. And just understanding that can get you out of this vicious cycle of chronic pain. And so it's really good for anyone to have. And for people who do suffer from chronic pain, it's concrete tools that they can use right now in their life to increase their quality of life and decrease their pain.
And how long is the workshop?
It's about an hour, and then there's going to be a 30-minute question period.
Oh, perfect. Good. So will be a chance for people to interact. And Okay, so we'll ask them to get them take some notes and make sure they get their questions asked. And well, that's great. Well, Alexia-Coulombe-Levesque, you're a physiotherapist and you're presently a grad student in the field of chronic pain at the L'Université de Sherbrooke. You've been really kind to take some time to talk about the upcoming workshop. Now, we'll, as we usually do, we'll put all the information in the video details, so the time and we'll put the link in there as well towards the workshop so that people can register accordingly. And well, hey, thanks for filling us in, and we'll see you next time.
Of course, happy to be here.
Take care.
Thanks.
Well, there you go. The workshop is coming up real quick on June 8th. So take a look in the video description for all the important details, including how to register. If you found today's information useful, well, please share and like the video, because it really helps us, well, spread the important information throughout the English communities of the Eastern Townships. And you can also subscribe to Townshippers Association's YouTube channel. Thanks a lot for being with us today. My name is Ed Humphrey. This is About Townshippers, and we'll see you next time.